Hello, guys. Welcome to the second episode of Brew Bones podcast series, wherein we elaborate about how to get into different fellowships and what are the career options in orthopedics. So, today, to elaborate us on the journey to Australia, we have Dr. Ravi Teja from Apollo Hyderabad and we have Dr. Pavan from Apollo Bangalore. So, Pawan sir, can you elaborate us on your training journey from
Mhm.
residency through the fellowships?
Yeah. Thank you everyone for inviting me for this Brew with Bronze program. So it was somewhere in 2015 where I happened to come across some fellows from Australia when I was in IOACon. That was in Jaipur. So that time, I met a few people and I just inquired about different prospects or different countries where I can pursue my fellowship. And a lot of the names came in, and out of them, they told me that Australian fellowship is very well renowned and. More hands-on over there, more research-oriented, and most importantly, more of basic teaching and the basics of arthroscopy, arthroplasty, or whatever you're interested in is pretty strong over there. So that intrigued my interest, and in my quest to pursue it, I came across a post in Facebook which told about SORI and about the AOA guideline of all the available fellowships which are available for people from overseas. So I did have a look at it. I went to their website. I had a look at AOA fellowship guidelines, and then I came across a few of them. And I was already offered a fellowship, and I did apply from. I made all of them, and I was offered a fellowship from Ballarat, the orthopedic surgeons there, which was for a 6 months fellowship. But it was pretty much, it covered everything. It covered arthroscopy, arthroplasty, knee, shoulder, spine, everything was covered in that. And then, it didn't really, even though I had applied for it and all that, it didn't really suit to my, particular liking, because I was more interested in arthroscopy, more into sports medicine, especially, and that's where I happened to get a reply from SORI saying that there are a few guidelines which they or few requirements which are necessary. So based on that, I completed all the guidelines, which is the epic verification and all those other things which is required, other basic requirements like getting our these certificates attested and all those things. I did all that, and then they told me that there's going to be a formal interview, and there's going to be some sort of verification of where I am and where I work, etc. So I did all the work. So this is a little bit, it takes time, it takes a lot of patience, and it takes a lot of consistency in putting this effort. So anybody who's interested in doing a fellowship overseas, it's important that you have a degree from a college which is recognized by the Indian Medical Association or NMC, which is now NMC. And most importantly, the verification has to be thorough. It has to be, there are a lot of things. It is a very smooth process, but then it will take time. So when all this was done, I happened to have a chance to talk to one of the surgeons there, who told me about what is the requirements and what is needed, etc. I got the permission from the hospital where I was working in at that point of time, and some recommendation letters from the HOD and from the director, etc. And then after that, I had got my letter of that they have accepted me for the fellowship for that particular year. So this is the journey from here, from India to the point where I got an acceptance letter from them. Yes.
Thank you, sir. So, one of the important take-home messages from your elaboration is the IOACon was the beginning point of everything. So that underlines
correct,
the
yes.
importance of attending conferences as juniors and start networking there.
Exactly.
So, how was the experience at SORI, sir? How was the academics and research part?
So SORI, Sydney Orthopaedic Research Institute, is focuses only on the knee joint. So everything on the knee joint. So over here, which I realized is they give a lot of importance on preservation. They give a lot of importance for for alignment, for preservation. They give a lot of importance for sports-related injuries. They give, we have workshops there. We had a lot of workshops over there. And over there, the procurement of cadavers, the teaching facility over there, the ground facility over there, especially in the cadaveric workshops, were amazing. They were the best. I've done cadaveric workshops in UK. I've done in Dubai. I've done in India. But then I think personally, Australian cadaveric workshops were the best. That was one of the highlights, which helped us as juniors to understand the basic nitty-gritties of what exactly the surgeon expects from the fellow, what exactly is their technique, and what exactly is their protocol. So this helped me to kind of get adjusted at a very early stage, these cadaveric workshops. And then, of course, the research part of it is they're always into, proper evidence-based research, nothing out of the ordinary. They are always into something which is done in other countries, which intrigues them, which interests them. They go ahead and at that point of time, they were doing a lot of in navigation. They always did navigation in knee replacements, and they had started doing navigation for osteotomies as well. So we did a lot of research on that, on the alignment part in osteotomies, where exact amount of patient specific implants which were used from some company which had sponsored it at that point of time. And this was something very new and which they even follow right now. So this is about the research. The teaching is almost all of the teaching was on table. Everything was we used to have days. Every Thursday was a day when we had surgery at the government hospital, and it was amazing. We had fellows over there, we had their own residents over there, and then we had our own way of interacting with them. We had our time to interact with them, and most importantly, we had to do our homework. It's not that we just go there blank. We had to do our homework. We had to know what surgery was there in the list. So we used to get it at least 2 days prior. We got the list. We had to do our homework. We had to go, to the wards, talk to the patients. Of course, we had to take some permission for that. And then came a point where it was very easy. It was easy to understand, easy to kind of know what the surgeon is expecting. And in between cases, we used to have a short time, about 15-20 minutes, where the shift over is happening. Of course, we used to help them in the shift overs, but then we also had time when the surgeon used to call us and we used to discuss about the case. This is the time when we exactly came to know about our decision making as a practitioner, decision making as to what the patient expects, what exactly is the plan, and how the outcome will be, and what prognosis we should expect from this type of patient. So this was an important part. It was not all surgical. It was not at all surgical. It looked so, it seemed so, because everything was in the OT. All the teaching was in the OT, but it was not. Most of the thing happened when in between the cases, that 15 minutes we had. Yeah.
Thank you, sir. Thank you for elaborate explanation. So the important points that you highlighted is that they had a good basic learning facility in the form of labs, and
Yes.
research was always a part of the fellowship, and the learning was quite good in the war rooms. Beyond surgeries, you get to learn how they practice and what are their lifestyles, etc. So Pavan sir, the next question is: you joined SORI in 2016. So how was
2000, yeah.
how was the application process during that time? So you told us you went through the interview, but before that, did they scrutinize your CV, and what research profile is expected of you for the application?
Yes. So pretty much the selection happened after they saw my research work. So this much I can tell for sure, because it was told to me by the surgeon also. So they had already made the decision when they, saw my profile. I had worked in UK. This was 2010. So that kind of helped me. That is one point. May not be that important, Not necessary that you should have worked somewhere overseas before also, other than India. But then I had three major research work, all on knees, all on arthroscopy, and it was something along the similar lines which people at Sori did, surgeons at Sori did. Also, the application process, as I told you earlier, it is a little tedious. I don't know how it is right now, but it is tedious because we need to get a verification from Epic. I think it's in the US, right? So where we have to send all our documents, we have to send all our certificates, all our degree certificates and registration, etc., which is confirmed. They do a lot of verification work, background work. We need to do a lot of emailing. We need to be consistent about that. After that, I had to make sure that I am a part of an institute here in Bangalore, and that I get a good recommendation from them that I'm a person with a job over here, and I'm doing such and such. So I had asked my director at that time about this particular opportunity, and he was kind enough to write. He did not exaggerate at that time. He wrote everything as it is. My resident medical officer also, he was also an orthopedic surgeon. He wrote about my qualifications and my work over there. This helped them a lot to make a decision. So this is something which is necessary to know. They in any fellowship, they need to know you before you come, because they have never seen you. Maybe they must have seen you at a conference here and there, but they need to know you. It's the same with Indian fellowships also. When people from overseas come, they need to know that person. Traveling to another country, possibly you want to go and get settled there. Possibly you want to go there for 1, 2, 3 fellowships. Some more observerships. So they need to know you. So these are the few things. Apart from this, when I went there, I had to do the APRA registration. That is the registration of Australian medical practitioners. So this is something which takes time, which needs to be consistent about applications. All your certificates should be in line. You need to have a protocol. You need to have a checklist where everything is ticked out. And when you do that, it's easy. It's not like, it's not a process where you get stuck somewhere. As long as everything is available, everything is clean and square and clean, then you can go through with it. Yeah.
So how was the hands-on experience? So as a fellow, when you joined there, are you expected to know about the surgeries that are being done there? Are you expected to have some experience? Are you expected to complete some basic fellowships in India before going there? Or you can directly go there after 1 or 2 years of your residency, and you can learn and build upon the knowledge that you gained there, work, and how is the hands-on?
So this is something which I'd like to ask you. So Giri, when you meet a surgeon, how long does it take for you, and you have started working with him, how long does it take for you to know that whether this person knows something or no?
Oh, that happens in 1 or 2 weeks, maybe even before that.
Even before that, know how they operate, how they handle the instruments, how they handle the tissue. They know what procedure is happening. So it took me about roughly 2 weeks, give or take. And then it was easy peasy after that, because I have already worked, I was working in an arthroscopy unit for almost 2 years before I went there. It gave me a good edge. And one of the research which they were doing, or which they practiced over there, one of the surgical techniques, that is, I did a research on suspensory fixation, both side suspensory fixation for ACL reconstruction. That we used to do every day over here. So that kind of gave an edge to me. But then they assess. They are surgeons par excellence. They have done a lot of surgical work, a lot of research work. They have worked with a lot of fellows, students, etc. And they will know that when this person is ready to be given as a second assistant, first assistant, main surgeon, or where sometimes they can just observe, especially in the government setting. They don't wash, they just observe, and you go ahead and you do everything. Yeah. You just need to, one more thing, very, very, very important thing, which they expect is you follow their protocol, their technique and their steps. This is very important. If at all if I try to improvise, then they don't like that. But having said that, if you want to improvise, you discuss beforehand, with them that I want to do this particular thing at this step of the surgery. I think that this is going to help me. If you can show them evidence about it, they are happy to change the course of what you have told. For example, there was a small little technique in which, a little technique in arthroscopic reconstruction where the mouth of the tunnel in the tibia, what they used to do is they used to clean it. I'll not tell the particulars, but they used to do they used another technique to do that cleaning of the tunnel of the tibia before they put the button. I showed them another technique. I told them that I think that this will be a little better and little bit of time saving in this, and I told them, and they told me, okay, show it. Then I did it, and they've been practicing that ever since. Yeah, something like that. Yeah.
So they are open to suggestions.
They are open to suggestions, but then they are sticklers to routine. They go by their protocol and their sequence. But of course, they will assess you like this. Any surgeon, I've also done a observership with in the shoulder guys over there. They observe you, they see you, and if you're good, then they're happy to let you learn and let you do the hands-on.
So the next question is, how was the social life, sir? How was Sydney for you? And how much was the stipend? Will we be able to survive on the stipend, or should we spend money from our pockets?
Stipend was good. It was as you would expect. It was pretty much, I was able to live a comfortable life, not a luxurious life, but there was no time for that. But I was able to survive without taking any money from here or asking for any money from my parents at that point of time. But at that point of time, the stipend was about 5,000 rupees, and I got few opportunities to assist some other surgeons during my off days, where I was, of course, I was given permission from Sori about that, and sometimes they only recommended me to go and help a surgeon out where his fellow didn't come or his resident didn't come. In that way, I used to get a little bit of extra earning over there because I had the after registration. I could have operated anywhere. I could have assisted anywhere. So that's about the money part. The standard of living is very high. It's a little expensive city, Sydney, as compared to other cities. Sydney is the most expensive. Then comes Melbourne, and then comes Perth, and then comes Adelaide, etc. So it was expensive. There's no doubt about it. Yeah. Social life was how it depends upon how you take it. Apart from we used to have our own parties and get-togethers. We used to have our own, pharmaceuticals. They used to have some meats and all that. Apart from that, I made friends there. There were a lot of Indians over there. A lot of people from here, from Karnataka, from Bangalore, from Hubli, which is my native place. So a lot of people, they, very friendly, very adventurous. I made sure that I explored each and every suburb of Sydney. So I never let my, weekends go to waste. I always explored. I always went out. I had a bicycle over there. I bicycled almost everywhere. I had an option of taking a four-wheeler, but I bicycled my way everywhere. The public transport is amazing. The people there are very friendly. Pretty much, overall, it was a good time which I had over there. Yeah.
So, can we take our spouse there, or should we live on our own? What is your advice, sir? What is your advice on shifting the family there?
So, in my experience, my wife at that point of time was doing her DM in pediatric oncology back here in India. So it was difficult for her to come. And also, during the first half, we had a small second child. He was a little baby. But then they did come in the holidays, and the houses there are huge. They are very good houses and all that. So if you see, I have seen people who have got their spouses over here. It's a little difficult with the amount of stipend which you get to take care of the family over there. But then you can manage. There's no problem. It's always good for people who are newly married or people who want to get their spouse over there. It is no problem. There's no problem at all. It is very accommodative. Expenses may be that one point. No, it will be a little difficult. I don't know what is the stipend at this point of time, but it will be difficult to manage in a city like Sydney, where you have only the stipend as a source of your income. No? So it will become a little difficult.
Okay. So in Story, it is an exclusive knee fellowship. So how do you
Yeah.
see when you come back home here? Should we do some other fellowships in shoulder? Because in India the practice is different, but it's coming like foreign countries now where we do only subspecialty practice. But how do you see when
Mhm.
you at that point of time in 2017 when you came back, were you able to practice the other specialties as well after 1 year of focused training in knee alone, or did you do some other observerships to get your touch up your knowledge in other subspecialties?
Yeah. So I did 1 year of completely on you, one almost 14 months, pretty much. After that, since I was going to the government hospital there, and we used to have, as I told you, every Thursday we used to go to the government hospital where in the morning we had teaching program. So I developed a few, network with the shoulder people over there, Sydney Shoulder Institute. So over there, I happened to meet a few surgeons. We were neighbors in the OT room. So I used to work here, and they used to work on the other room, neighboring OT. And I just spoke to them, and they were very happy to take me as an observer. And because I had the after registration, I had no problems in doing hands-on surgeries over there. So I did officially about 6 weeks of observership with the shoulder people, but then I was there for a few more months over there, and there was no pay over there. But then I was happy to help them out and happy to learn from them. And Dr. Benjamin Cast was the main lead over there, and I enjoyed his company. He used to take me to his OPDs. There was no pressure there because over here in Sydney, in Sori, I was a fellow and they were the boss. And here it was completely casual, where he just took me in as a friend and he wanted to teach me about his techniques, about shoulder, etc., and also about general stuff, about life, about politics, about the word, this and that. And it was fun with him for a few months. Also, I happened to observe a few surgeries on the foot and ankle with Dr. Vines. I also observed some elbow surgery over there, and also the other outpatient procedures. Usually we used to have our knee thing over there for some particular OPD slots in the government hospital, but I was happy to see other general patients also. So that kind of increased my network. And back home over here, I think that when I have done my fellowship in knee joints, exclusively I practiced knee surgery. 80% of my surgeries are arthroscopic surgeries, there's no doubt about it. But then I do foot and ankle, I do shoulder, of course, I always did also. I do hip, I do elbow. There is no problem in doing any of that. Of course, in India, if you see, I think this is not from what you are asking me, but here in India, you pretty much should know everything. You have to pretty much know everything, general orthopedic, because this is how we were taught. They never concentrated on subspecialty practice because everyone did everything, and we were taught that way. And I think that if you see something about foot and ankle or the hand, it's not just in the books. You can actually do it, and if you want to try it, and if you have the right amount of knowledge and guidance, you can always do it. Yeah.
Thank you, sir. Thank you for the elaborate. So the main point is when you do well in a fellowship, the word gets out and other people are ready to help you out and you want to learn from them as well.
Yeah, of course.
Thank you, sir. So this will be the final question since you are very busy in OPD practice right now. So at that point of time, how was it getting into Australia as a consultant, sir? So was there a possibility of immigration? Was it very difficult?
Yeah. So this is a very important question because a lot of people, even I at that point of time, thought that I will switch over, to practice over there. It is possible, but then for that you will have to go through their, particular, registration process, where you have to do a sort of a residency. If you have a fellowship already in Australia, it will give you an edge, but you still have to spend at least 5 years or so to do their residency program. And there are certain areas where you can get. There's something called as area of need, where you can be posted to some places where there is a necessary of a surgeon or an orthopedician. That also there are certain things which you need to, if you really are interested, then you need to work on it right now. Everything is available online. You can just check that out, send a few emails, know what the process is, read about it, and then you can go ahead and get settled. But the over there at Royal North Shore Hospital or Royal Prince Alfred Hospital in the city in Sydney, it is pretty much difficult to get in there because people who have studied there, only it is a little difficult for them to get into a program of subspecialty or specialty in orthopedics over there. And pretty much over there, everybody in an institute, they do subspecialty practice. There's no one who does this and so and that also. Maybe in other smaller hospitals, or there are surgeons who have individually made a name for themselves. They have started practicing in everything, little bit of here and there. But then subspecialty is the way to go over there. So there's a little bit of, I've never made a sincere attempt for that. I just heard from people about it. But then it is possible. New Zealand is another option. If at all you want to get into program over there, or if you want to get into working over there and all that. But then it is something which you can look for as to what is their new rules and regulations under.
Thank you, sir. Thank you very much for joining us and elaborating on all the points that is needed about Australian fellowships. Thank you very much, sir.